people do pap smears only when they are detected.
For the many years, the pap smear has existed. It has been a good screening tool.
Yes, correct.
But one has to start to look at screening from a risk perspective. When you're screening someone and you're giving a certain output, what is happening today is that generally diagnostic tests will provide an output which will be either binary or threefold output, mild, moderate, high, etc. What we are looking at is actionable output. So although pap smear is a good test and it will be continued to be a good test for screening, there are better tests that are out there, namely HPV. So the fact that one has high risk HPV is a much better correlating factor to future invasive disease or invasive cervical cancer than the pap test. And the world is moving towards
HPV is the first test and then comes pap smears.
The pap test is a cytology test. Effectively, you're looking at the cells. It is high in places like India. There are reasons for this, but the sensitivity of this test is at around 70% for many reasons. I won't delve into those. As I said, it's a good test if you have good quality assured labs and good well-trained individuals. I'm not saying that India doesn't have great well-trained individuals. It says that consistency is lacking.
Right. But I think that's the problem worldwide, right? We cannot just categorize it.
But quality assurance is another factor. Right. So let's assume today pap smears are your standard test for cervical screening. As I said, HPV testing, and this is not me saying this, is a WHO recommendation that if you can afford it, then high-risk HPV test is the ideal test to assess the patient's risk towards cervical cancer. And if they do have high-risk HPV, then the next suggested examination is eligibility for ablation through colposcopy, effectively triaging. One has to visualize the cervix to decide what you're going to do next.